there are things, conspiracy theories that are coming up for people, a degree of uncertainty about the pace in which all of this has happened. But I think a lot of that is either rooted in, fear and frustration, but also, appropriate levels of concern and skepticism. I think that communities of color have a right to be a bit skeptic of what's happening. But I think that this is an opportunity for the medical establishment and researchers to do better in terms of engaging communities so that the research enterprise can be more trustworthy.
One of the things that clearly has turned out to be an advantage to us in responding to COVID-19 is the fact that many of us have been involved in the whole business of exploration of vaccines as relates to HIV. One of the things that we learned during our HIV work is that the faith communities were clearly a vehicle by which we could engage persons who have the trust and who have the avenues and the vehicles by which they're able to speak to and address, such that we can not be compromised by some of the long-standing reservations that people might bring in terms of their issues of trust or in terms of issues of apprehension with regard to scientific research, and in instances in the past, how there has been situations where persons have been exploited.
The medical establishment has not done a great job of engaging Black communities, and has not done a great job of integrating Black communities, and medical bias and healthcare provider bias is still very real. Black people in communities of color still continue to be treated differentially when they go to see healthcare providers. So racism, systemic and otherwise, still exists in this country. And I think that there's, again, a reason why that all of this exists that extends far beyond the specific messaging for COVID-19.